Good morning. Welcome to the Marin Communications Forum. Glad to have you all here as we begin our sessions for the new year. I'm really happy today to have two really important presentations with data about our Marin kids. I'm thinking back to probably 10 years ago. Dr. Bob Ross from the California Endowment came to speak to our annual policy breakfast, and I picked him up at the airport, and he said, "So why am I coming to Marin? What's the problem? What's the need?" And that continues to be the problem, is that people don't know there's the need. And that's what today is all about. We really want to go through the data and statistics and talk about the disparities in Marin and talk about the needs so that we can all better advocate for our programs and better advocate for our children, youth, and teens. So without further ado, I'm very happy to welcome Kelly Hardy from Children Now, and she's going to be making a presentation on the county scorecard that they've just released on their website. Thank you.
Good morning. Thanks so much for inviting me here to talk about the California County Scorecard. I'm Kelly Hardy. I'm the Senior Managing Director of Health and Research at Children Now. And for those of you who don't know Children Now, we have offices in Oakland, Sacramento, and LA. And we are a statewide policy, research, and advocacy organization focused on making kids the top priority across all policymaking in the state. We've been around for 30 years, and I've been with Children Now for 13 of those years, though I'm newish in the research job. I also have my sidekick and data expert extraordinaire, Ashley DeAlba, with me for those tricky questions that I'm sure you'll have. So here's what I'd like to cover with you today. I'll give an overview of the scorecard and then dive into the data on child well-being across the state to give you some context, and then focus on the Marin numbers. I'll also demonstrate the scorecard tool that we have online, and that as of today is available on your phones in a mobile version. You can check that out after we talk. And then, of course, take a bunch of questions and focus in on what's really important to you. I want to emphasize that we at Children Now developed the county scorecard to be of assistance to people exactly like you. When you're advocating, when you're trying to make sure that policymakers understand the issues and strengths for kids in your community, we are trying to be a resource to you. So very happy to take any thoughts and questions you might have. How many of you have heard of the scorecard before? All right, good numbers. The purpose is to track key indicators of education, child welfare, health, and early childhood across the counties. And we've produced the scorecard since 2007 at Children Now. It's taken many different forms. This year we have a new mapping format that we're hoping is more user-friendly and easier for people to look at. It's meant to help communities identify where there's weak spots and bright spots for kids, and foster collaboration across counties and within the county to make things better for our kids. As I said, it's an evolving tool, and so we're really trying to make sure it's useful to you. This year, the scorecard has 30 measures related to those 4 categories, and we added 10 new measures and really tried to include more measures on early childhood, so I hope that that is helpful to this crowd. What you should know, because as I'm going through the presentation, I'm sure you'll think, oh, I really wish that there was data about whatever thing you're most interested in. We choose indicators based on 3 criteria. Is there data available across most or all of the counties? And that is tricky when the counties get smaller up in the rural north. can we break the data out by race and ethnicity for most of these indicators? Because that is such a critical way to look at the data. And last, does it fit on a 0% to 100% scale? And by that I mean 0% is bad on these indicators and 100% is good, so that you can look across all 30 and see where the numbers are lower. And it makes it easier to kind of look holistically at the data. So that can make for some strange wording like not low birth weight for the indicators, but that's intended to make all the numbers be going the same direction for positive outcomes. So again, there's many issues that I'm sure you'll identify, and we are always thinking about what we want to include in the next iteration of the scorecard, but we're trying to focus on those three criteria as well. The scorecard reports out on data from multiple primary sources. We do not collect the data ourselves. And I will show you once we get to the actual scorecard where you can look up the source if you're a data nerd like me and really want to dig into the source data. All right, so let's check out the data. And you have the data in front of you, the printout. I'm going to ask you to put that at the bottom of your pile for now, and because there's a pop quiz, and some of the answers are in there. So, and I also just want to focus on what we're looking at for California's kids, so statewide. So this is the most recently available data for all of these numbers. Usually that's 2017. In some cases, it's 2016 or 2018. Overall, there's 9.26 million kids in California, and almost half have one or more immigrant parents. And again, almost half are living in families where they're at 200% of the poverty level or below. Which is $50,000 for a family of 4 per year. I have my own opinions about why the federal poverty level is used across all states and all counties, where it's obviously higher cost to live in Marin County than many, many places in the country. But that is where we're at, $50,000 for a family of 4. And you can just think for yourself how far that's going to stretch. There's over 200,000 students experiencing homelessness across the state. 52% of California's kids identify as Latinx, and we use the Latinx descriptor to be more gender neutral. So on to the pop quiz that I promised you. Any thoughts, and our superintendents and such may be ringers on this question. So any thoughts about what percentage of California's 12th graders graduated on time in 2017? Just shout them out. Any ideas of percentages? 75. 70. All right. Good guesses. We're actually at 83%, which seems pretty high to me. That's a pretty good number. Then moving on, just juxtapose what percentage, same denominator here. So all the 12th graders, what percentage do you think were measured to be college or career ready upon graduation? 20. All right, we've got some pessimists in the crowd, but I like it. 41%. And the college or career ready measure is, there's 5 different ways to meet that. I'm not an education policy expert, so the ones that make the most sense to me are that a student has fulfilled the A through G requirements to be ready to enter UC or CSU, or they've gone through a career technical pathway, completed the entire pathway, and shown themselves to be ready. There's some other, I can refer you to the source, and I'm sure Ashley knows them off the top, but really showing that they're ready to take the next step, right? So if 83% are graduating on time, but only 41% are college or career ready, that certainly shows a gap. If you have a diploma, but you're not really ready for the next step, what are we doing there for our youth? Okay, last set here. So what percentage of eligible students, so students who are low income enough to be eligible for free or reduced price meals, do you think eat those meals during the school year? Any thoughts? You guys are being quiet. I was expecting loudness here. Okay. Yes, right? So this is across the whole state. And again, those averages hide a lot of variation. 54%, nice. So that's eligible kids. For whatever reason, they're not eating, they're not, leveraging that both nutritional and financial benefit that's available to them. And then same denominator here, but what percent of eligible students do you think are eating those meals during the summer, accessing them through a community location like a library or a school? 20%. Other guesses? Okay, this is really low, only 8%. We need to be doing better to get nutrition and financial supports to those families over the summer. So just pointing out some of the places where we looked at sort of pairs of measures that really seem to point out a problem. Some of the biggest challenges that we see statewide when we look at the data are around supporting our youngest kids. So childcare, and I'm sure this comes as no surprise to this room. Childcare is simply not available enough at a reasonable enough price for our families. Oral health for children ages birth to 5 is getting better, which is hard to imagine at 26%, but is still way below what's needed. And then some of the academic areas, there's huge disparities and also really low numbers in many places, such as being conditionally ready or ready for college level math, and 8th graders who are meeting grade level standards in math. After we went into this data, I went home to my 7-year-old and started a new math program. I was thinking, we gotta get ready. Other challenges that we see, touching on nutrition, again, the eligible students who are receiving those free and reduced price meals, that's really too low. And care sort of globally for children in the child welfare system. They're not getting the dental visits that they need. They're not getting the medical visits that they need. They're not in stable placements, bouncing from place to place to place. What can that do for their, health and education and well-being? And also exiting from the child welfare system to a permanent home. We're not doing enough for our kids in the child welfare system there. So that's the bad news. And of course, there's many of us in this room and beyond who are working very hard to improve these numbers. We also see on all 30 of the indicators really either large racial disparities, geographic disparities, or both. Some of the ones that stand out are for 3rd grade reading. And here it's 76% in Placer County and 33% in Alpine County. And again, we're comparing apples to apples in that we're comparing each county to an overall scale on these numbers, but realizing that different counties have different resources to tackle the problem. So this isn't to point out the rural North counties as, not doing well enough, but what can the state be doing really to get more resources to help in places where there's problems, or what can county groups be doing to band together and ask for more help from policymakers. It's not to point out folks as not doing enough. Another disparity that we see here is around readiness for college-level math, wide disparities among the different races, and then the counties here are 52% average in San Francisco and 15% average in Lake County. And then on pregnant women getting prenatal care in the first trimester, again, these numbers are perhaps not as stark, but it's a much more life and death circumstance, right? So there's racial disparities, and we can point to all of the studies that show that Black women of any income and education level don't get the maternal and prenatal care that they need. Even if they seek it, they're not getting taken care of well enough by our healthcare workforce. And that counties are ranging from 91% in San Mateo to 50% in Modoc. All right, I know that's depressing, but there are some bright spots. And where we do see the better numbers are places where the state and counties and organizations have really invested, not just for a 2-year budget period, but really over a long period of time, invested in making a difference for kids. An example on that is health insurance. I've been a part of, and I'm sure many of you have been a part of, making sure that every child in California has access to affordable health insurance. And we've made huge strides, including in 2015, the passage of Health for All Kids, where undocumented kids are able to access Medi-Cal. And so, again, that's concerted effort over a long period of time. I know immunizations are a hot topic here in Marin, but overall we're doing well statewide. And again, on some of these more public health indicators, I think those numbers are higher. In addition, some of the school climate measures are looking pretty good around improvements on the kids who are being chronically absent from school, which we know is a bellwether measure for success later in school and in life. If a child's chronically absent, then it tends to reveal lots of other problems that are happening for that child. And as I mentioned, the 12th graders who are graduating on time, that's a relatively high number. Let's talk about your kids. I know that you want to focus on Marin children. And I'm going to just take a moment to pull up the scorecard so that I can show you what it looks like on the actual tool. Can I take this with me? Yeah, okay, great. Okay, I'm gonna try to walk and talk. So on the scorecard tool, if you go to the Children Now website, it's prominently located, and this is what it looks like. If you choose Marin County, you can then choose between indicators in these 4 categories, and it will show up over here. So, for example, we've got newborns who are not low birth weight. It highlights Marin County, but then you get the full experience of the data across all of the counties. Over here, you'll also see the county demographics, right? So this is just a reminder of, we're looking at this number for newborns not low birth weight, but here's the bigger picture. I promised to show you the sources and notes. Here in this top right corner, you can look for sources and notes, and this gives you the detail of where that data came from, and also what the race categories mean in this data, because they're different across every indicator. And then you can hide the sources and notes. And if we come down here, you can see the breakout by race where we have it for that specific indicator. So it shows you some of the disparities that we've been talking about. When I go up to the right-hand corner, we've had a lot of questions about this, but here it is. If you just want to print out what you've got in front of you, that PDF, you just hit this button here. In addition, you can toggle between, this is the 2016 data, the most recent available, and then over here we've got the 2015 data, so you can sort of see if there's a change over time. The county overview section over here shows you where Marin falls in sort of the rankings of the counties. And where they're clustered like this, the county ranking doesn't mean quite as much, but where there's a larger spread, that county ranking will tell you quite a bit. In addition, you can focus in just on Latino kids, if you'd like, and see in counties with the most Latinx children, here's how the different counties are doing. All right, so that is how the scorecard works. If you have questions, if you hit this provide feedback button down here, it will go straight to Ashley and I, and we will do our best to answer your questions. And I believe that takes us back to our homepage. There was one more thing I wanted to point out. Oh, you can see all the counties by just expanding there if you wanted to see the full list. And again, this is the more interactive part, and then if you want something you can print out and take to a policymaker or talk through with somebody, you'll probably want to download the PDF that just gives you the numbers. All right.
So we're supposed to be the healthiest county in California, so what does a 94% mean?
That's a good question. So we'll get into the Marin data a little bit more here. And I think as Michelle was highlighting, your numbers are, overall, they look pretty good, right, compared to the rest of California. But pretty good compared to the rest of California does not mean okay or enough for kids, right? So that is really where I'd like to focus, because I think that in many cases we're doing well by our kids, but in others there's just not enough support. And I'm really excited about the new Newsom administration and the focus on early childhood in particular, and the recent appointments of Chris Perry and Nadine Burke-Harris, Dr. Nadine Burke-Harris, who focuses on childhood trauma, to the Newsom administration. I think that that just continues everything that we see coming out of the Newsom administration, and everything we've been talking with them about really signals that it's a new day and a new opportunity for those of us who focus on children's policy issues. And we need to change our mindset from reactive, really, to much more proactive. And what are the policies we can put forward? Let's dream big. So I'm really excited about that, and we've got a lot of work ahead of us. Here's again just the demographics of your county, which you know much better than I do. And as indicated, Marin is near the top or at the top of California counties rankings-wise on many indicators. And these are places where I think that many of your kids in your county are doing really, really well, but there are still certain groups that are being left behind. And so really digging more into the places where all kids in Marin are not doing as well, and where where you've got more disparities for other groups, I think is the important work here. You don't need to be patted on the back so much for all the stuff you're doing really well. I think that is critically important, and the models of what you are doing that you think works to achieve these numbers, I think is important to spread across the state. And it's also really critical to then look at where there's not as much support for kids. So some of these numbers are around third grade reading, eighth grade math, a lot of the academics. Marin is really near the top. Children who were not food insecure, the newborns breastfed in the hospital, which anyone who's breastfed knows that's a terrible measure of breastfeeding, but those are the measures that we have available, whether the newborn was breastfed in the hospital, and the care taken for some of the kids in the child welfare system. So just looking at those numbers. Now, where is Marin not doing quite as well compared to other counties? Kindergartners with up-to-date immunizations, and as I indicated, I know that's a real hot topic in Marin. I think that, while the numbers don't look terrible, it's true that Marin is not at the top there. And then the eligible students receiving free and reduced price meals during the school year. So again, this isn't overall students, it's the eligible ones that are actually leveraging that opportunity. Kids in the child welfare system, adolescents who are in family-like settings, meaning they're not placed in an institution or in group care, the foster youth graduating high school on time, and the children exiting to permanency in the first year from the child welfare system. So I'm wondering if these rankings feel true to you, and maybe during the Q&A we can talk a little bit more about, if these feel like the pressing issues in Marin County, or if you'd put other ones at the top of the list.
Kelly, do you have the numbers for those as a referee to be able to say?
Yes. So for immunizations, and these are all on your PDF. For immunizations, the California average is 95, and the Marin County average is 94. So again, there's not a ton of difference, but that puts you at 35 out of the 58 counties. For adolescents in the child welfare system placed in family-like settings, Marin's at 62%, statewide is 73%. Youth in foster care graduating high school on time, Marin's at 47%, and the state's 51%. And children exiting to permanency from the child welfare system, Marin's at 28%, and the state's at 36%. Again, these are pretty bad numbers overall, right? But Marin needs to be doing more for those kids. And then we've got the eligible students receiving free and reduced. Marin's at 52, and the state average is 54%. I also wanted to call out some of the racial disparities that seem to pop out. And again, because Marin is a smaller county and the numbers get really tight for some of the racial groups, we don't have racial disparity numbers for each of the indicators. But where we do, these are the places where I see the biggest disparities on the graduation rates. And you can follow along on your PDF by looking at that indicator and then moving across to see what the disparities are for the racial categories. The suspensions due to defiance and disruption, which has often been used as a way to kind of push kids out of school. Third grade reading, eighth grade math, college math, overweight and obesity, overall, countywide, these numbers look really quite good. So it's interesting that some of the categories where we see the best overall numbers are where we also see big disparities. And then the young low-income children who visited a dentist, if I'm remembering correctly, that's a place where Latinx children are actually at 58% in the county, white kids at 35%, Asian kids at 59%. So that's a place where children of color are doing better, and I wonder what's the outreach mechanism, what are the systems there, what are the successes that can be learned from to bring those numbers up countywide. So I mentioned some of the data challenges that we have, and Marin is not the most challenged, trust me. When we get to the rural north, it's more of an issue. But I would just point that in places where we don't have large enough sample sizes or small enough the standard error. What's the normal term for standard error? Yeah. Where we don't have good enough data, basically. Those are places where you can use multiple data sources like kids data, and we're going to hear from Allie. Local county departments, there's many here, and you have great data that needs to be tapped. Sometimes it's very difficult to get that data if you're not within that county department for lots of good and bad reasons. So really tapping that data and feeding it up so that it's usable by advocacy and other organizations. You probably are aware of the California Strong Start Index, which is using birth records and to look deeper into the data, and it has a cohort approach. And there are others that I'm sure I'm not aware of, but really using all of your data sources to pull that together and get a fuller picture of what's going on in your county, I think is important. Our scorecard, I love it. I think it's beautiful, but it's got limitations, and it has that approach of looking at where we can get the data across all counties. So especially in the rural north, we're talking with folks more about partnering so that we can get perhaps an average across 2 or 3 counties where there's probably less racial diversity or diversity between those counties. Moira Kenny likes to say that there's more diversity on her block in Berkeley than there is across some of the counties in the rural north, which is probably true. So being able to leverage that fact and get bigger numbers, I think, is really important. Working on data advocacy at the state level so that we're looking more at collecting the right data so that we can best help our kids. And then public-private partnerships. Can you partner with, for example, managed care companies who do collect quite a bit of data, but sometimes it's held close to the vest. So these are places where I think we can try to get as much data as possible to drive decision-making and policy-making. I've mentioned to a few of you, but we're working on Children Now is working on a project with Contra Costa County to dig more into the local data so that we can look at differences between school districts and between West County, Central County, and East County, and tease out some of those differences. So I think that's a really exciting project, and we're hoping to do more of that as we go forward. And then I would be remiss if I didn't mention the children's movement. So how can we get all of these numbers up to 100% where we want them? The children's movement is Children Now's answer to try to leverage all the power of organizations like you in the room, and many of you are children's movement members. There's 44 children's movement members in Marin, organizations, businesses, and others. To really leverage that power and get to the place where we can bring a support letter to the governor and say there's 600 child-serving organizations signed on to this letter. It needs to be prioritized. That's really the work of the children's movement, is to try to amplify the voices of people who work with and for kids. So if you check out childrennow.org, you'll see much more about that. And I would love to take some questions. And I'm just going to, while you're thinking of questions, I'm going to check how I'm doing on the time. Doing okay? Yeah?
Questions?
Yeah, on the data thing, you didn't, sources, you didn't have school districts mentioned, which I think, the data we have, like on free and reduced and graduation rates and stuff, are kind of different than what you're showing for Marin. What, why are you not looking at data from school districts? Is that because of confidentiality?
We are looking at, I think I'm understanding your question correctly. We're looking at data from school districts, but the scorecard specifically does county averages. But if you go to that question, to that measure on the scorecard and click on the source, you will go to the CDE, the California Department of Education data quest, that breaks it out by school district. I'm calling a friend. Yes, it does break it out by school district. And yeah, that's a really important way to look at the data. And the school district data, anything related to education, we're more likely to have broken out by sub-county divisions.
Okay, other questions?
How come you have suspensions not due to defiance and disruption?
So there's a recent state law that some of my colleagues in our education department worked on to make sure that it's to make it much harder to suspend or expel a student due to defiance or disruption, which can be something like, chewing gum when you were told not to chew gum. I've heard of that example. I am not a teacher or a principal, so I don't have that direct experience.
Those changes in law are for 1 through 3rd grade?
Yes. And that's something that...
So as you go up, suspensions for defiance and disruption impact kids of color much more so than white kids.
Absolutely. So we're pushing to extend that from 4th to 12th grades as well as 1 to 3. But this is just to get a measure of, are there still those discrepancies going on, those disparities, and is it something that's impacting certain counties more than others? And
is the California Healthy Kids Survey one of your sources?
It is. It's a source for the questions about students who reported feeling connected to their school and reported feeling like they do things that make a difference at school.
Okay, those break down very different by school district and schools.
I'm sure. Thank you.
In relation to race.
And Kelly, if we do call those up again, like you showed earlier, you could you could select by ethnicity and other details, correct?
That's right, if we've got it for that one.
But you don't have it for that.
No.
Yeah, there's some that there's just no data on it at all.
Yeah, there's somewhere we simply don't have the numbers.
We do find that's often a problem in Marin just because of the small
Yeah.
sample sizes, particularly when you go
We don't
down
have
to
the breakout
community
by
level.
race.
That's an issue some people might want to talk about, right, Meredith?
Yeah.
Well, yeah, that's actually what I was going to ask about, because I wanted to see if that data was also, brought down at a zip code level maybe, so we could see it a little bit more in depth. Would that be available through the website?
Not through the scorecard website.
Yeah.
This is county only. As
The
I
whole.
mentioned, we're really working on and know the need. We've definitely heard the need for smaller smaller, down. Yes. I think Allie might be able to speak to that more as well, but this is intended to be a snapshot to look at sort of where are the county structures doing better for kids, because there's so much responsibility pushed down from the state to the counties, and so we're trying to look at where the counties are have those supports in place.
I'd love to see the available childcare slots broken down from birth to 3 and then a 3 to 5, because it's quite a different picture if you break out those age groups.
That's a good point. Thank you. We'll see if that's available.
Thank you. And our next forum on February 25th is going to be about childcare. So we'll try to do some work in advance of that and make a handout with more detailed data.
Great.
We're supposed to be the healthiest county in California, according to our health officer, this Johnson & Johnson report. 2 quick questions. When you eliminated school nurses, did this have an impact on immunization and healthcare rates here in Marin County, number 1? And the second thing is, my kid, who's a principal, said, how do we compare with states like New Jersey, New York, where they give $20,000 per kid, and he says we only get something like $10,000 or whatever the figure is per kid. So the question is, giving more money from the governor, would that help your figures here in Marin or around the state? And the school nurse business.
Right. So school nurses first. There's been overall a drop in availability of school nurses statewide, and I don't know what the county policies are here. I did notice that in the LA teachers strike, one of the gains that they got was a school nurse in every school. So maybe that's a model for other places, not the strike so much, but I'm not fomenting. But I do think that that's definitely a place where we see that kids aren't getting, used to get some of the connections to services and mental health care, and some, school nurses used to know the families and the kids and be able to connect them to the services that they needed, rather than just, there's a nurse at my son's school sometimes, but she's really a Band-Aid putter on her, not so much a resource. And it's nothing against her, it's just the model has changed. There's an organization called the California School Nurses Organization, CSNO, that really works on this issue. And I know it's a priority for children now. On how we do on education in California versus the nation, on spending, we are certainly, spending per pupil, we are near the bottom in California. And so money would absolutely help. I think that, it has to be a combination, right, of money and the right policies and putting the money in the right places. So it's not a simple answer, but I think that if there was an increase in per pupil spending, that would certainly help.
Are our figures better than Washington and Oregon here in California as far as spending?
Per pupil, I'd have to look it up. I don't know.
Oh, we're down at the bottom.
I think we're near the bottom with like Missouri. Someone may know better.
Oh, in California, per pupil spending, we're about 41st in the country. So, and there's efforts to bring us up in the top 10, but it'll take a long time. So
Yes.
speak up for that. Linda Jackson, trustee in San Rafael Schools, and just thank you for the scorecard. It's great to have this kind of data, and like any good data, it promotes more questions
Yes.
about what does this mean, because they're averages. And so, as people have pointed out, I'm wondering if you looked at gender and differences between boys and girls in this data. Have we made reductions and so that's not included, or is that included but just not on this printout? Thank you.
Thanks for that question. It's not included in the scorecard. I've had a couple of people ask me about that. We do at Children Now work on, we have a whole STEM effort. And that's where we do the most work on girls versus boys and how folks are doing in school and the different outcomes and supports. Does kids' data break out by gender? Yes, we do. There you go. So I think that there's different resources. We tried to keep this very streamlined to be able to show it to policymakers and staff who could look at the data. Thanks.
Hi. I'm very concerned about the big difference between the percentage of kids graduating high school on time or something like that, and the number that are ready to go to college or ready to take college classes or something like that.
Right.
And what are you attributing the huge difference to? And do you think some of these tests that we are requiring our students to take and pass that aren't really related to the subjects they need to learn to be ready for college, how do you think that relates? Is that something that's getting in the way? Thank you.
That's a great question. It might be better answered by some of the superintendent and district and school board type folks in the room. I think when we look at the data, it's a simple graduation, which is kind of a more of a base number, versus did they go through these 5 ways to prove that they're ready for college or career?
But we graduate kids that do not know how to read hardly and can barely write. I've seen it. You know, I've been involved in classes like that, and the teachers say that's what we're supposed to do. Can't, you know, we're not allowed to hold it back. So you hold the kid back. You let a kid go to the next grade, they'll never catch up.
Mm-hmm. It sounds like you think that's one of the top priorities that should be kind of on the, I don't think that's represented as a real problem on Marin's county list.
I mean, when our students aren't making it in the world stage, you know, when our students can't compete, to me, that's a big deal.
Right. One of the problems I would say with A through G is if you don't start on time, if you don't, that freshman year, if you don't have the first set of classes, like you can't recover from that. So you have to be placed in those classes, and a number of times you have to qualify to be placed. So I think that's definitely something that we want to look at to make sure that middle schoolers are ready to take the first set of classes that will allow them to complete A through G.
That's a good insight about that measure. Like maybe those 5 ways of measuring college and career readiness are not a great indicator of what's happening, but I also hear the concern that perhaps more broadly kids are not graduating
And I'm also
ready.
just concerned if we make any assumptions about certain kids in middle school and kind of assume that they're not A
Right.
through G kind of kids, and just to really make sure that everyone has the chance to do that if they can.
Yeah.
Other questions or comments?
Just to add a little to that, I also think it's about remediation as well. What are the remediation possibilities for a student who may have failed a class for whatever reason? What are their summer school possibilities? All of those things really influence this whole idea of being career and college ready.
John over here has got a question. He's principal of Bolinas. We've got to hear from you.
Just to clarify, I'm the superintendent of Bolinas Stinson School District and Lagunitas School District, each of which has principals, and school nurses part-time. I also, I spent a lot of my career in at the high school level. And I think when you talk about college readiness, it's really important to understand that A through G does not guarantee college readiness. So as a measure, it's sort of suspect. Like, you have to have your A through G requirements to apply to a four-year college, but just because you have them doesn't mean that you're ready or that you'll get in. And a lot of kids who complete their A through G, when they take the a placement test, find out that according to the colleges, they aren't ready. So that's in math and in writing. And it's, I forget, I don't know what the current number is on that, but plenty of kids who get through high school do really well. They take those tests and find out that they're not as ready as the colleges think they should be. So there's a pretty huge disconnect between what we see as readiness through high school and that jump into college, because it's not the same people or the same systems making those determinations. And public colleges have an obligation to go with A to G requirements, and private schools don't. So there's some complexity there. But I think the thing I really wanted to stress is that it's important that we get kids on track for college even before they get to high school. So like in both of my districts, one of our clear, probably the most important element that I want to see academically is that all kids are ready for Algebra 1 as freshmen, because that's the gatekeeper. If they're not ready for Algebra 1 as freshmen, they are facing, it's not impossible, but they're facing a real uphill battle with college readiness. So starting way back in articulated curriculum, even back to kindergarten, so we know what we're doing in math all the way up through 8th grade, so we can say at least Algebra 1 or higher by the time they graduate. So.
And it sounds like there's lots of interest in this college and career ready measure. I'd encourage folks to look at the sources and notes on that one, so that it's not just A through G, but there are some other ways to fulfill that measure. So if you want more detail.
Hi, how could we get information regarding the preschool and TK information?
We've had a lot of discussion about that. So there are numbers. The numbers are, there are numbers from the American Community Survey. That's the right source. They are not good numbers because the margin of error is really large. So there are, you could put in numbers there. We decided not to because we had a certain standard of, if the margin of error is too large, we're not including it because we don't want people to make policy-making decisions based on that. But I believe there's a cabal of strong folks here in Marin County who are committed to getting those numbers that I've heard from. And so I think that's going to be more of a within-county effort to really get at the truth of what's happening. I think that the TK numbers are available, and we got those from Erickson. Right, okay. But I think the preschool numbers are harder to get at.
What specifically would be required to make those numbers better for preschool? Is it local survey?
Is it a local survey?
Data collection?
As from a research perspective, I think there's a lot of things that you can do. So it just depends on where you're coming from. It's part of survey collection. It's within county efforts. So if it's to improve the margin of error, that's more survey collection from more people participating in the American Community Survey would help get that margin of error smaller, and meaning it would best represent the county better. But again, other than that, there's many ways that we could adjust that. Yeah, so again, so if there's those efforts want to be made, I think that's something that could get those numbers for you. But speaking on a survey that tries to collect those numbers, participation in that survey would get those numbers higher.
I would just say as an aside, I was randomly chosen to fill out the American Community Survey this year, and it's kind of terrifying. So if I wasn't as privileged as I am, I don't think I would fill it out. It asks for, some very personal stuff. And so I have a new appreciation, I think, for why we don't get really good participation on that. So I do think that some kind of grassroots effort where organizations, there's a finite number of preschools in Marin County to get the numbers. It wouldn't be easy, but I think that would probably get at the truth a little bit better.
Great.
Does
Thank
that
you.
answer the question?
Yes, thanks.
Yeah.
One more question. Let's get on to kids' data.
Hi, sorry, I'm looking at this last data point here. Children with parents in the labor force for whom a licensed childcare slot was available. So are you saying that 60% of parents that want a childcare slot do not have a slot available?
That's right. The ones that are a licensed childcare slot, so they might have a slot, but there's not a licensed childcare slot available.
So it's saying that they want it, but they don't actually.
It doesn't matter whether they want it or not. It's right. They're working and have kids.
And would need one.
So the number of families who are that versus the number of licensed childcare slots there are. Does that make sense?
Yeah. Okay.
Okay.
Okay, we'll have time for more questions. Thank you, Kelly.
Thanks so much. Thank you. And please do feel free to email at research@childrennow.org. That goes straight to the two of us if you have any deeper questions. I'd love to answer them. Here we go. Slide.
Thanks very much. We want to continue on now with Ali Rivera from Kids Data. And you'll see how on the Kids Data tool you will be able to dive deeper and get some more specifics on the numbers that you're interested in. So thank you, Ali.
Oh, thank you. Wow. Okay, so all these questions are super, super important, and I'm really excited to be here. This is my first time presenting for Marin, and quite honestly, my last time I was here, I think it was 8th grade in Marin Headlands for a week-long stay-over field trip. So happy to be back. It is. Sorry, what? I don't believe so. Oh, okay. No, it was through my school, just hosted it. But yes, so happy to be back. Just briefly, so Kids Data, kidsdata.org. Just going to be giving you an overview of what the Kids Data program is and some data highlights specifically for Marin. So today's agenda, as I just mentioned, there will be an overview of Kids Data, the program, as well as the website. And then I'll identify some inequalities within Marin and show you how to access that data using kidsdata.org. And then I wanted to just share a little bit on how to use that data for action, but I'm sure all of you are well aware of certain parameters and certain quick tips, but I just wanted to share a little bit. And then I left plenty of time at the end for questions, but please feel free to ask me throughout my presentation anything that you would want to know. So as I mentioned, Kids Data is a program, but it's from the Lucille Packard Foundation for Children's Health. And this is what you would see if you went to the Lucille Packard Foundation website, and you can access Kids Data through here. But of course, we have our own other homepage that I'll get into a little bit later. Kids Data is a public resource online that has a large list of comprehensive data on children's health in California. It's a program of the Lucille Packard Foundation, and the foundation's mission is to elevate the priority of children's health, and its vision is that every child reaches their maximum health potential. And so we do this in 3 ways. Firstly, through our fundraising. We fundraise for the Lucille Packard Children's Hospital, as well as the School of Medicine at Stanford in Palo Alto. Secondly, we have a deep focus in children with special healthcare needs. That's our grant giving side, and that's the department with which I work the most with. And also within that special healthcare needs group, we like to improve the quality standards, care coordination, and increase family engagement within those talks amongst policymakers and state level agencies. But then thirdly, there's a Kids Data program, which has more of a wide focus on issues that affect children's health. And so today I'm going to be going through how you can use it and a little bit more about it. So the Kids Data's goal is to provide wide-ranging, high-quality, and local data. So when you go to the website, you will have more than 55 topics, and then within those 55 55 topics, you'll have more than 600 indicators at your disposal. And those indicators, these data come from more than 50 reliable data sources that I will be talking about on the next slide, as well as within those data, you can break it down by different regions. So that includes California state data, county data, city data, school districts, and legislative districts. And then also by demographics, so that includes race, ethnicity, age, family income, and things like that. But aside from just numbers, we like to provide research-based narratives and information that can help you figure out why these data are important and how children are faring within California. And we also have narratives that show some policy recommendations surrounding the data or that specific indicator. So as I mentioned, we do not personally go out and ask you survey questions. We have partnerships with several administrative level data services, both from the state level and from the federal level. Some of them you may be familiar with, such as the California Healthy Kids Survey. I heard someone mention that earlier, as well as the U.S. Census Bureau and the California Department of Education. We're really, really excited about all these partnerships, and we really try to reach out to them as much as possible, and we sometimes have presentations with them and also have a long-standing relationship with them. Just to go and highlight directly for Marin County, I wanted to show some data. It's really funny that you mentioned the child care availability data earlier, so I'm going to just show you what we have to offer for Marin County. This shows the percentage of children with parents for whom licensed childcare is available and unavailable. So you can see it's almost 50-50. 55% of children for whom care is available within county. So of the children in Marin County, 55% of them for whom childcare is unavailable. And only a little bit less than half childcare is actually available for them. This is licensed childcare, so this doesn't include grandparents or family members taking care of them. This is licensed, service providers. Furthermore, I wanted to give another highlight in the topic of bullying and harassment. Sorry, this picture's a little depressing, but it is not a light topic, and we're really excited to share this kind of data with you because it's one of our more newly updated data, and I'll get to that in a little bit. So this shows within Marin County, at least a third of children across all grade levels have reported that they were bullied or harassed in the last year. These data come from survey data from 2013 to 2015 data. So just kind of absorb that, if you will. It kind of doesn't matter based on the grade level, and at least from these data right here, children across grade levels are feeling bullying and harassed. But you may want to take that a little deeper and see other demographics within it. So this breaks it down by race ethnicity. This shows that of the students in Marin County, of the African American and Black students, 50% of them have reported that they were bullied or harassed in the last year. And if you wanted to see more demographics, we can show you by sexual orientation or level of school connectedness. Just a show of hands, can someone define for me what level of school connectedness is? No? Okay. Oh, would you like to share?
That's how connected the young person feels to the school environment. We don't spend a whole lot of time creating an environment for them to feel connected to. That's why people in restorative services use community building circles in grade schools so young people can bring their authentic lives into the school environment, and that increases empathy and decreases bullying.
Oh, beautiful answer. I could not have said it myself any better. But yes, so these are student-reported data survey answers, but we also have within this topic of youth in schools, data also from the staff perspective. But as you can see, of those students who have identified as LGB youth, more than half of them have said that they were bullied or harassed in the last year, as well as for those who show low levels of school connectedness, more than half of them also were bullied or harassed. Yes?
Question, just a second.
So it looks like transgender is not included in that. Can you tell us why that might be absent?
That's just based on the data question itself. It only includes lesbian, gay, and bisexual in that question, but also we're trying to look at sexual orientation, not gender, or sex, I should say, sorry.
So does this slide show that we need more work in this field, or what does this show compared to these other counties? What does this show?
This shows that there are disparities within the children in Marin County based on their sexual orientation and level of school connectedness. You could dive into why are these there? Why is the LGBT community feeling more bullied or harassed? Why are those who have low levels of school connectedness feeling like they're, insignificant or feel like they're not comfortable within their school environment? And that isn't very conducive to a healthy education for the long term. If they're bullied or harassed in school, they're not going to feel welcome there. They're not going to feel like they matter, or they're not going to be as engaging in their education and really want to improve themselves.
So does the school have to address this, or who addresses this issue?
I think the school has to address this and trying to increase the positive school climate within their own schools and maybe encouraging their own children as well, or the students, teachers at their own students' schools, if that makes sense.
One here, Don.
There's actually a mandate from the state in budgeting, LCAP, to increase school connectedness.
Wow.
But there's a challenge in getting schools to actually target that activity with that money.
I wonder why that is.
And we had one more comment here.
I have a first grader at Basich Elementary, and he was bullied twice this year as a first grader. And when I reported it to the school had said that it didn't fit the bullying and harassment requirement because it hadn't happened more than twice. So is this based on how the kids are feeling, or is this based on the school district's opinion of what their explanation of bullying and harassment is?
That is a great question, and it is from the student perspective. It is not from the staff perspective.
In state law, to be classified as bullying, it has to be classified as pervasive. Now, that's a slippery kind of definition that you can wiggle around. I've worked with schools who would rather label it as assault rather than bullying because they don't have to make a state report for assault, but they do for bullying.
Wow.
We need a program on bullying.
Okay. I think some inspiration is coming from this presentation. I'm just going to go on a little bit, but obviously you can explore this more on our website, and I'll show you even if you want where the bullying and harassment data is located. So as I mentioned, bullying and harassment is from a larger section of Youth in Schools data, and we recently released a large suite of it in August of 2018. We updated and provided new indicators all within these topics of alcohol and drug use. Bullying and cyberbullying has really been a popular topic, as well as emotional health, which includes feelings of depression or suicide ideation, as well as school climate, school safety, which is where the feelings mostly are from the student perspective, and then student supports at school. And you can go to the website at kidsdata.org/youthinschools, and it'll give you our whole blog page, which breaks it down further into more indicators within these topics. So how can you access this wonderful data? I'm going to be showing you a little bit of a live demonstration on how to use kidsdata.org. However, before I do, these are some questions that you're bringing up, but other questions may arise from these data that I just showed you. How do issues of equity across student groups affect First 5 interventions or any interventions that you may want to host within your own communities? To what extent do current school support and community systems meet students' needs? It's not always about, it's not county-wide initiatives. It could be something much smaller because you need to think of who has access to these resources and are they actually equitable across all other school districts or legislative districts, and how can data support your actions. I think one of the most important things in policy advocacy is really to share the numbers to support your statements, but to make them listen is to make it into a story and showing that you have a long-standing relationship with your program and you want to make them care about it so that they can implement policy change. And just a little quick here, I'm going to show you how to use the data, but these are some of the end products you can use for your reports, for your grant proposals, for any other work that you want to use it for. We like to show that you can identify disparities, you can monitor trends, and you can also make comparisons using pie charts, tables, and graphs, all that you can, within 2 clicks on kidsdata.org, you can make for yourself in a PowerPoint, in a Word document, whatever you choose. So
I have to say hooray for that, because being able to customize a report, and in, like she said, like in 2 clicks, you can have pie charts, bar charts for your specific topic, and it looks like you did a lot of work and they did it for you.
Okay, so this is the kidsdata.org homepage. Before I dive into it, I just wanted to show you, you can definitely briefly look up anything that you need here in the general search box. But if you're interested in more, thank you. If you're interested in more of the just what Kids Data has to offer, I really encourage you to go to the A to the Z index, also located up here. It's more visually apparent. I don't know. Is everyone okay with it? Can you see pretty good? Okay, great. If you're ever interested in some of the newly updated things, we like to share it here in our carousel, and that'll take you straight to our blog posts that tell you way more information about it. But today I wanted to go dive into data by topic, because I have a specific topic that I'm looking for. And once you go here, it'll show you 8 categories with which we break out our data. And if you're interested in specifically just Marin County data, I really encourage you to go to data by region. And there you can see it by legislative districts, counties, cities, and school districts. And furthermore, you can see straight for just Marin County. If you're interested in demographics, such as age, gender, children with special health care needs is also one of our demographics we like to point out. You can go straight there. Let's go back to data by topic. So I wanted to show you specifically education and childcare. I know we had a hot topic of school climate, so I think we're going to go here. First of all, these orange are the topics. So this is the more than 55 topics that I mentioned before. And if you click into it, you see a large set of all blue, which are the indicators, the more than 600 indicators that I mentioned before. That's where you can directly access the data, and you can see it by its different breakouts that are available to them. Before I go into the data, I wanted to show you the summary spot, and that shows you a general input of all the key highlights that we want to show you, and so that'll be visually apparent with the map, or if you click play on the carousel, they show you other highlights that we just don't want you to miss, basically. And if you want a general idea of school climate and how it affects California in a holistic way, this is where you would like to see it. But let's go back. Data by topic. Early childcare and school climate. School connectedness was also a hot topic that we just brought up, so I think I'm going to start there. And this is where you can actually see all the data available to you. First of all, every indicator that you open up will always show you first in a table format, so you can see it comparatively across all the indicators. On the left, you'll see all the geographies available to it, so this is broken down by counties. And you can customize that. You can unclick or click as much as you want and compare as many counties to each other as you want, or you can even compare it to California data. Up here, you can customize your data by the years in which the data were accessed. We always show you first the most updated data that we have on that topic. And furthermore, you can narrow it down even further to different grade levels or even non-traditional schools. Non-traditional usually includes students that aren't within the 7th, 9th, or 11th grade breakouts, and could include homeschool children or just in things like that. This also shows level of school connectedness. So on the PowerPoint, I only showed you high and low, but we also show you medium here on the website. So just going to keep it general for now. Furthermore, you don't have to just see it in a table format. You can see it in bar, map, pie, and if the data allows, it would show you in a trend tab right here. And if you wanted to show it in a PowerPoint or in a Word document, you would go straight to Download and Other Tools. So you have it Word, PowerPoint, Excel, PDF. You can even customize the data that you want in that PDF, so you're not just stuck with what we give you. And you can even embed it in your own website if you'd like. So as I mentioned, we don't just have numbers on here. We like to give some research-based narratives and information. But just like I mentioned school connectedness, say you didn't know what that really meant, so you can just click here, and at the bottom of every indicator, we show the definition of what that indicator means, where the data was accessed. So this is through our partner, West Ed, which I know Children Now also partners with them, and from the California Healthy Kids Survey and the California Department of Education. A footnote also likes to show you any of the caveats that we may have for these data. As you can see just right here, non-traditional schools, they have an S, and so S usually means that they're suppressed, usually because there's too small of a sample size, and right here it tells you exactly what that S means. Okay, so further down, we have why this topic is important. Well, we already know that anything related to children's health is pretty important, but it gives you more of a concrete definition and a way to explain it better for anyone who may be confused. And further topics of how children are faring within California across all counties and across all grade levels, and anything that you may find interesting, as well as any policy implications. So, of course, we're not policy experts, but we do like to share our input and how these data can affect policy change in the future.
This is a really great source if you need to put together a little commentary page quickly and don't have time to do 2 weeks of research. They've already done it for you.
Right, exactly. We also show you where we get our knowledge from, because we're not all-knowing either. And any other research and links that you'd like to know, or how to access other data related to it.
Ellie, we had a question here.
Oh, of course.
Yeah, I don't see, but that doesn't mean you don't have it. Charter schools, where are they in this in terms of kids identifying, all those things about schools? You have grade level, but there's significant differences between the charters and the public schools. Do you track charters?
I am not familiar if we do. It could fall into that non-traditional section, I believe, but I will have to get back to you on that. I will check with our data person.
That might be a good thing for both organizations, just to let people know, because it's such a big issue, not only in Marin, but statewide, for advocacy purposes and otherwise.
Charters are not tracked by this. Non-traditional is alternative schools and county schools.
Okay, thank you.
Charters are public schools, so
Right.
I believe they're included in the public schools.
Right, included in public school, but it'll be interesting to,
I don't know if they're separated.
just a sec. Comment?
Also, ladies, we have 18 school districts, 17 or 18 school districts now here in Marin County. Do we know, like in the school climate, are all of the districts reporting? Do we know that?
You can see which school districts are within any indicator. I'm just going to return to the top here. If I go straight to Marin County, you can click on this plus button right here, and it'll show you other breakdowns. If you were looking for legislative districts, it would also pop up here, but it is not available for this specific indicator. And you can just click and see all the school districts that are included. Sometimes not every school district is included.
So Dixie, Kentfield, Lagunitas, Larkspur, Mill Valley, Novato, Reed, Ross Valley, San Rafael High School, Sausalito, Marin City, Shoreline, and Tamalpais.
Yeah, so you probably know better if your school district is represented here or not, but we do try to include everything as much as possible, just depends on how much the data allows.
Thank you.
So if you want to look specifically at Marin County, I like to click this Clear All button and just start fresh, and go down straight to, if this computer likes me, and then select all school districts, and you can compare how your school district is to other ones. Say you were really interested in only 9th graders, see how they're faring. So you can unselect or deselect the rest of these. And maybe you just want to see how many of those are actually feeling very connected to their schools. So you just select high, and it'll give you these. So NA, as I mentioned, gives you, their just data are unavailable. So
Probably because of small sample size?
no.
Oh, thank you. Yeah, it's because we just selected 9th graders. Thanks.
Okay, yeah.
Go to Sausalito School District in Marin City and see if they disaggregate the charter from the public.
I don't believe you can see that from here. This is all the school district data for this indicator. That's for the grade.
It's just because you're looking at.
Right, you're looking at 9th grade.
This is for 7th grade. So you can see there's a wide range of access, perhaps, to school activities or engagement from the student's perspective. And take that as you will, really, of how you think that, what are some, I'd like to open it up to you guys. What kind of programs do you think would be most beneficial to maybe see a more cohesive level of school connectedness? How can we raise everyone collectively in all school districts to the same level?
Don? I'm just going to get Don his own microphone.
You're in my wheelhouse. The best way I've seen is for young people to able to handle the discipline at their schools, peer-to-peer restorative discipline procedures. That makes them feel highly connected. We don't give kids agency early enough in this culture. They're quite capable of making good decisions and supporting each other's success.
It's a very good point. Anyone else like to share?
Over there.
This is dangerous because it could go on all day about this stuff. But when kids feel connected to what they're learning, when they understand what they're being asked to learn, and when they are able to give feedback to themselves and work with adults to make sure that they're mastering the subject matter, they're going to be a lot more connected to school. When they're in a school that's based on compliance and following all the rules exactly the right way, and they feel like the reports they're getting back, like A through F report cards, for example, are irrelevant to them, that really increases disconnectedness. And so getting kids to feel like what they're doing is relevant is probably a hugely important thing.
So perhaps if we included more projects that are real life oriented, could that help them connect it to much better? Yeah? Yeah.
Yeah, and I think schools need to do, I'm a former school teacher from many years ago, and then I got into early childhood, and what I loved about early childhood was that there was such a much stronger connection between the child care teachers, providers, and the parents than I had found when I was an elementary school teacher. A lot of schools say, they stop the parent at the door and they say, okay, now this is our space, not yours. And I just think that greater effort to involve parents in their children's education makes a huge difference in how the children feel connected to their school experience. And also the arts, I have to put that in. Also draw children in and get them more involved.
Yes. Thank you.
Okay.
I live in a community with 300 old geezers called, over here called Smith Ranch Homes. We have 5 retired teachers in our facility, and every Friday for the school term, they go down to Santa Venetia Middle School, and every Friday they read to the kids. They don't read to the kids. The kids read to them. A question: do you ever make use of seniors, bringing them into the schools just for simple things like reading and this kind of thing for your PTAs? Or I was just wondering if there's better utilization of seniors who've got free time that could assist you in these math scores or these reading scores. And it's just a thought.
No,
Great
that's
idea.
a good question. I personally don't work with school organizations, but I think for any student, it'd be really important to know that their time is valued, and being seen that their time is appreciated from elderly would really be a huge ego boost and a huge positive interaction to see that they matter within their community. So then they should be more active within their school community as well, so that they can kind of receive that positive or perpetuate that positive feeling within their school environment. I just wanted to pause so that I can continue with the PowerPoint presentation. But if you have any questions on how to use the website, please come to me afterwards. I would love to answer any of your questions like that.
Also just wanted to point out that Allie also had handouts. They're on the table outside the room. There are 3 handouts, also a data summary, like the Children Now summary. And I also included First 5 Marin's annual report, which was just presented to our commission recently. And there are 2 pages with a quick data summary that can be printed out back to back if you just need a quick handout to take to a meeting. And we also, if you were with us last year for our forum on race counts, I did a little summary page of some of the children's issues by race and ethnicity. And so that's a good, just single page handout if you need to advocate for children on those issues. And you'll see, because I was ill while this was being finalized, I was able to make one little correction. This is on the 3rd grade reading, and added the word not, which was children not reaching grade level, which is kind of a critical difference. It will be available on the website, and there are hard copies out front. For now, it's hard copies. Yes.
Okay, so I just want to wrap up my presentation here to talk about how to use data for action. As I mentioned, more than data, a story is always more compelling. And if you have ever used kidsdata.org, or if you want to use kidsdata.org in your grant proposals or in your reports, please reach out to us, because we love to hear that story, and we like to post it on our website for others to see as inspiration for their own data use. And so that is the Data and Action tab that you may have seen on the website. And next to it is the News tab, where we have all our blog posts from our bi-monthly email newsletter. And we share a lot of data highlights that we like to focus on. In the past, we've shared about our LGBT youth data, which we'll be having a webinar on in February. So February 1st, it's a Friday. If you'd like to tune in, it's only a 30-minute webinar conversation. There will be 2 presenters. First, from our partner, West Ed, Jenny Betts, yes. And then the second one will be an LGBT youth from UC Berkeley. She will share her high school experience as an LGBT youth. So that we already went through a very quick practice run, and it was very, very empowering in a way, her story and her experience. So I really encourage you to sign up. You can register on kidsdata.org, Youth in Schools, or you can just share with me your email, and I'll sign you up myself. So thank you so much.
Thank you so much. Any other questions or comments before we go?
How big is your staff?
Our staff?
Well, it seems like a lot of data. How many people do?
Right. So for data specifically, we have 3 contractors, and then our main data His name is Nathan Porter. He's our data guy. He's a full-time staff employed by the Lucille Packard Foundation for Children's Health. But for community and outreach, we also have myself, including 2 other people that are on it. One is half-time. I'm part-time on it as well. And then there's another, Lori Turk. She's the head of Kids Data program, and she's there full-time for Kids Data.
I just had a question, maybe just to open up to the floor to ask if anyone has the resource for it. Coming from a dental perspective in dental oral health, we're finding that the gap for us tends to be in the first 5 years, when the kids aren't being screened for proper dental cleaning until they're required with the oral health assessment for kindergarten. And the challenge is that's too late. Kids should be screened 6 months after they get their first tooth, so by the age of 1. So by the time they get to a dental office for that dental health assessment signature, they are showing dental caries, which affects to absenteeism, which affects to them maybe not eating properly, other things that affect their health. Is there anyone who knows or can guide me into where a good resource would be to try and find out what education is being presented to parents or maybe the pediatricians to try and let's tackle this issue so that kids are healthy from a younger start at dental health? My hygiene.
Funny that you should ask. And again, just to repeat, February 25th is going to be our forum on oral health. Introduce yourself.
I'm Jennifer Zuniga, Children's Oral Health, County of Marin. Oh, stand up. Okay. Oh, okay. Hi. Yeah, so I work with the county on the Children's Oral Health program, so I would definitely like to talk to you after the presentation, and I can give you some more information on what education I'm giving out at some of the preschools and also some trainings that I do with preschool providers. I'm going to be working with some student nurses here shortly as well. And like Michelle was saying, we have the next communication forum will be on oral health, so that would also probably be a good resource for you. And other than that, we have an oral health advisory committee that would be a good resource as well.
Is there anything other than that? Because if you're talking about preschool, you're looking at 2 years old, and we're talking about like parents' education, like a newborn class or something where we can reach parents earlier.
Right. Oh.
Hi, so I'm Anne, and I'm a public health nurse with the county, and I'm actually the Child Health and Disability Prevention Program Provider Relations Nurse. So I work directly with pediatricians' offices to ensure standards of care, specifically for children on Medi-Cal, but of course most of our pediatric offices serve a wide variety of children with different insurance. And one of the things I've really been focusing on, I did a bunch of site reviews this last fall with 11 pediatric providers in the county, and one of the things I'm really focusing on is oral health assessments in the pediatric office. It's a standard of care for Medi-Cal providers. Pediatricians need to be looking in the child's mouth whenever they do a well child exam at every well child exam. So that's, I think, like 10 times until the age of 3, and then it's yearly after that. So that's definitely something I'm focusing on. So there is someone addressing it, and if you have any questions, feel free to come talk to me.
But I also think that that's part of, I think this was the indicator where you saw the discrepancy, right? Where it was actually Caucasian children that had a lower incidence. And I think part of that is because we're in community clinic and the CHDP providers do such an outstanding job in our county. And so the education needs to be that, that's sort of the standard that all pediatricians should be using. That mouth needs to be looked at. And I think there might be an assumption, with well-insured families, they're getting dental care.
But by the time a pediatrician looks at the patient's or in their patient's mouth and they visually see something, by that time the decay is already.
No, but they should be looking in their mouth at every exam. Like that's the standard, is looking so that early on.
Right, but I was just saying, but looking at it, by the time that you have visual caries in the mouth, it's gotten to such a larger proportion that it's almost immediate assistance is needed by a pediatric specialist at that point.
I just wanted to chime in. Children Now does a lot of work on oral health. I don't lead it anymore, but and I know First Five has been a huge leader on children's oral health, but the 2 is too late catchphrase I think is really important. And I know that WIC offices are also, depending on the office, but a place where a lot of people get sometimes oral health screenings, but also just the information. We have a project that we're working on in several counties. I'm not sure what it's like Sacramento, San Joaquin, and some others around connecting pediatricians, making sure that pediatricians are connecting kids to a dental home early. And so I think there's a lot of work to be done there, but I know that First Five is a real leader on that issue.
Thank you. And so for those folks who are really interested in this issue, you're going to want to join us next month. Just to let you know, Marin County has a new, there's a new needs assessment that's been published. There's a new website. We'll be telling you all about it next month. And we'll be showcasing 3 work groups that are being formed. And some of the work being done is on outreach and education. And we'll be doing that by age group and to pediatric offices and to different communities. So we'd love to have your input. Thanks everyone for joining us today. Really great discussion. Thank you to Kelly and Allie. And we'll hope to see you in February. Thanks for coming.